What syndrome is associated with lesion of the areas of the corticospinal, corticobulbar, and the fibers of cranial nerve 3? Think, and then we'll dive into this question together. All right, it is going to be our medial. All right, it's going to be our medial. But which one is it? The medulla or the midbrain? Well, it's going to be the midbrain. It's going to be the midbrain. And the reason why is this is Weber's, right? Medial, which is our M, tracks, and the cranial nerve 3 would tell us that it's our medial. And if you don't know why, let me actually just show you. There's this awesome graph that I love using, which I'm going to plop right here for you. Boom. Okay, so we can tell that these guys, it's going to be a medial. We've got to memorize this, our PCA, and then we have here our medial, and then our laterals on the side. And then remember, their numbers that are inside the medial are 3, 4, 6, 12. They're all divisible by 3, and then you add the 4 here because 3 times 4 is 12. That's just like a way to remember this. Let me just scroll down so you can see this. There we go. Check this out. 3, 4, 6, 12. Okay, so midbrain here, we got some medial stuff, and this is going to be our Weber. So this is going to manifest with either contralateral spastic hemiparesis, contralateral hemiparesis of the lower face, and ipsilateral oculomotor palsy. But let's dive in here. Let's explain this so it's super simple. 66-year-old man, emergency department, after collapsing while walking, and he's got a weakness of his right arm and leg, lower facial droop, and his left eye is deviated down out with a dilated pupil. History of hypertension and type 2. All right, so we got a lot of stuff going on, and if you're like me, then you don't really like all these neuro kind of signs. It just kind of makes you confused, especially at first, but here we're looking at a nice little brain here. And if it's a stroke in the middle of the brain, which we know it is, it's the medial midbrain, because cranial nerve 3, we know it's right in the middle, then that stroke is going to damage your corticospinal tract. So we'll zoom up here. Our corticospinal tract and our corticobulbar tract, and also our CN3 fibers, our oculomotor nerve. All right, so it's going to be this third nerve right here. And the oculomotor one controls your eye muscles, bulbar controls your face, and then your corticospinal controls your arms and your legs. So what happens? On the same side of the stroke, ipsilateral, you're going to have cranial nerve 3 palsy. All right, so the eye will go down and out, and the pupil is going to be big and dilated and down and out. That's what the cranial nerve 3 is going to do. On the opposite side of the body, contralaterally, you're going to have your arm and leg weakness. Cortical spinal tract is going to go out. But see, up here, it's ipsilateral. Here, it's contralateral. You're going to have your lower face is going to drop because the corticobulbar and the spinal tracts are going to be gone. So imagine the brainstem is like a highway with 3 lanes. One lane goes to your eye muscles, and then the other lane goes to your body muscles, and the other one goes to your face muscles. So you got these tracks going on. And if a stroke blocks all 3 lanes at once, then you get one eye broken on the same side, and then the weak and body face on the opposite side. That's Weber syndrome. Okay, that's pretty much all there is to it. Now, if we want to go a little bit more sciencey on us here, what we know is that it's a medial midbrain stroke. And so we know that it's going to affect the opposite arm, and then also the eye is going to be down and out. It's just the crossed findings of the brainstem. Let's look at the other answers of why they're incorrect. So we have our lateral medulla, that's Wallenberg. Lateral is Wallenberg. I like it because it's LL to Wallenberg. This has no cranial nerve 3 involvement. You'd see hoarseness, dysphagia, trouble swallowing, and Horner syndrome, and also ataxia. Our medial medulla, so that makes us think of a medial medullary syndrome. That would not be 3, it would be 7, cranial nerve 7 palsy. Tongue deviation and contralateral hemiparesis. So that's not going to be quite it. Our medial medullary is going to involve our 7. All right, so lateral pons, that should make us think of here we can scroll down so we can actually kind of see this. Lateral pons here is going to be our cranial nerve 7 palsy. It's going to be our AICA syndrome, but it's not going to be our 3. It's going to cause hearing loss and some vertigo. So yeah, that's going to be your lateral pons right here, boom. And our medial midbrain, yes, internal capsule, what does that do? That's going to be a pure motor stroke. And the cranial nerves do not run there in your internal capsule at all. So, all right, hopefully this is helpful. These neuro things, they're just kind of tricky sometimes. So hopefully this is a helpful little breakdown of some of these concepts. But yeah, we'll make some more neuro videos in the future. Hopefully we'll make them really, really simple so you can identify all the strokes. But guys, this is just the goated picture here. Yeah, we'll see you in the next video.